79 biosafety committees, IBCs, composed of local scientists and officials. Critics say these are free to interpret the official guidelines in a way that suits them. There is no effective national system to ensure consistency, responsibility and good judgment in such research, says Edward Hammond of the Sunshine Project, a biosecurity pressure group in Austin, Texas. In a review of IBCs published this month, he found that many would not provide minutes of recent meetings as required by law. He says the IBC that approved the planned 1918 flu study at the University of Washington considered only one scenario that could result in workers being exposed to airborne virus, the dropping of samples. Its solution: lab workers will be trained to stop breathing. Bird flu vaccination could lead to new strains. Asterisk 1900, the 24th of March 2004 by Deborah McKenzie. Vaccinating chickens may be the only way out of the bird flu nightmare in Asia, but it could also lead to the evolution of new strains, the latest research shows, increasing the risk of a human pandemic. Only intensive surveillance can stop this happening, but experts say the countries affected do not have the necessary systems in place. Last week China declared its bird flu outbreaks had ended. Health officials are vaccinating millions of the birds that escaped slaughter. Indonesia is also vaccinating, and other Asian countries hit by the H5N1 bird flu are considering the same strategy, but the H5N1 virus is almost certainly still circulating among the vaccinated birds, and the fear is that in this abnormal setting it may evolve into a form that is not only fatal to people, like the current one, but can also spread from person to person. 18. Precedents: the abandoned swine flu mass vaccination program of 1976. In 1976, a mild swine flu swept through the United States. President Gerald Ford mandated a mass vaccination program, which was carried out by the same vaccine companies as today, that had to be abandoned because of the catastrophic results. President Ford was acting on the advice of medical experts, who believed they were dealing with a virus potentially as deadly as the one that caused the 1918 Spanish influenza pandemic. The virus surfaced in February 1976 at Fort Dix, New Jersey, where 19-year-old soldier, Private David Lewis, told his drill instructor that he felt tired and weak, although not sick enough to skip a training hike. Lewis was dead with 24 hours. The autopsy revealed that Lewis had been killed by swine flu, an influenza virus originating in pigs. By then several other soldiers had been hospitalized with symptoms. Government doctors.
Yep, blame the poor pigs. Look how long they've been blaming the pigs and blaming the birds, blaming the monkeys. And it was them all along. It was them all along. Bastards.
80. Became alarmed when they discovered that at least 500 soldiers on the base were infected without becoming ill. The incident recalled 1918, when infected soldiers returning from the trenches of World War I triggered a contagion that spread quickly around the world, killing at least 20 million people. The nation's health officials urged Ford to authorize a mass inoculation program aimed at reaching every man, woman and child. Mass vaccinations started in October, but within weeks reports started coming in of people developing Guillain-Barré syndrome, a paralyzing nerve disease, right after taking the shot. Within 2 months, 500 people were affected, and more than 30 died. Amid a rising uproar and growing public reluctance to risk the shot, federal officials abruptly canceled the program. Dec. 16. In the end, 40 million Americans were inoculated, and there was no epidemic. A later, more technically advanced examination of the virus revealed that it was nowhere near as deadly as the 1918 influenza virus. The only recorded fatality from swine flu itself was the unfortunate Private Lewis. Healthy men, women and children went to receive the untested swine flu injection and died as a result of the injection. Others received permanent injuries. The program was stopped. An Australian doctor, Archie Colocarinos, gave his account of his involvement in the 1976 swine flu pandemic. In 1976 I was working in the far north of Australia amongst Aborigines. I observed, in one community of only a few hundred people, when they were given the flu vaccine, probably the Victorian strain, but this detail does not really matter because nobody outside a few selected individuals really knows what is in any particular batch. 6 men died suddenly soon afterwards. They were not all old. One was in his early 20s. A few weeks later, in another community I found that individuals with heart or potential heart problems or diabetes were particularly likely to drop dead soon after being given the vaccine. Obviously, there was a problem with some batches of the flu vaccine. A few months later I was in America. President Ford had been told by his health advisors that there was going to be a huge epidemic of swine flu, that this could kill May thousands, and the only way to prevent this catastrophe was to vaccinate the entire population of America, every man, woman and child, with a specific vaccine. So the vaccine was manufactured and the biggest vaccination campaign in history was begun. I was concerned because the vaccine could not be properly tested in a short period. None of the recipients would know anything about what they were being injected with, and the chances were that many would die suddenly. Furthermore, it was extremely unlikely that an epidemic of swine flu would occur. So I spoke out. At first the newspapers got hold of what I said and headlined, "Australian physician call it mass murder." Then I appeared on Kathy Crosby's television program. Watching that was a man in New York who did not like a gentleman named Gambino, the mafia boss. Gambino was about 70 years old and had a history of heart problems. It was a simple matter to get someone to persuade Gambino to have the flu shot, and Gambino obliged by dropping dead. The newspapers got it right when they stated, "Mafia flu jab conspiracy." People were dropping dead in the buildings where they received their shots. Others became.
My goodness. Did you hear all that? It sounds like they tried to call the population in 1976, and I guess they failed somewhat.